So that's about the reporting. It's important just you don't have to report this year, 2015, but come 2016 you'll be reporting on 2015, and that's for groups with over 50 employees only. So the other thing I wanted to go over was the shop exchange. So this is a new thing for small businesses. It was available in 2014, but only for groups in Vancouver, like kind of by Vancouver, Washington, Southwest Washington, because the only insurance company that sold down there was an HMO called Kaiser, and they only sell in that small area. This year it's available for through MOTA, one of the plans and they sell in all counties in Washington State. So this is good for small businesses with low-income employees. If you're a small company, I'll explain exactly how that works. Small company with low-income employees, you may be eligible for a tax credit. Prior the tax credit was available using any plan. So if we've sent out notices ever since 2012. This small business tax credit was available, and you should be applying for that. Part of the law says that you're eligible for the small business tax credit just 2 consecutive years. So if you've already used the tax credit in 2 years, then there should technically be no more tax credit available for you. So this shop exchange doesn't really matter. So this is pretty confusing, so let me kind of back up one more thing. So when they wrote the healthcare law, they have this individual insurance exchange, and that's where low-income individuals that don't have access to employer coverage can get subsidies if their income is low enough to get private insurance. They also wanted to include this thing called a small business exchange. And so this was supposed to be a marketplace where small businesses could go to be able to buy, maybe offer employees more options, more choice. The way it's turned out, though, is really if you're in King County, Pierce County, Thurston County, Snohomish County, anywhere besides Southwest Washington, the shop is just one option. It's MOTA. And that MOTA plan available through the shop is the exact same MOTA plan that's available outside of the shop. So, at the exact same price. So what we found is there's absolutely no reason to go through the shop exchange unless you're going to get tax credit because your company qualifies. Because the shop exchange adds another layer of complexity to your enrollment and slows down the timeline, and you're buying the exact same coverage you could get outside the shop. So when we're looking at employers, small group employers that may potentially be wanting to buy a small group plan, we look at first, could you be potentially eligible for a tax credit? If not, then there's really no value in the shop. If you wanted that MOTA plan, we would just sell it outside the shop. That way you don't have to deal with a whole new computer system and enrollment and so forth. We could just enroll in the MOTA plan like we do any other plan. But if you haven't been getting the tax credit for the last 2 years and you are small group eligible, then it's definitely worth looking at, well, what could your potential tax subsidy be? If that's a significant number, then yeah, we can sell through the shop. For us, we can do it either way. It's the same, like I said, same premium, same broker commission, same everything. So how do you qualify for the tax credit? First of all, you have to have under 25 employees. So if you're over 25 employees, absolutely no tax credit. Doesn't matter what incomes are or anything. And on this one, you count employees over 30 hours count as one employee. Employees under 30 hours count as full-time equivalent. So when I went through the how to count number of employees for the purpose of 50 or more in reporting, it's the same rules for this shop exchange. You have to have average wages under $50,000, and the tax credit is up to 50% of the employer contribution. So if the employer is paying 75% of the premium, then the tax credit could potentially be 50% of what the employer is coming. And the tax credit comes back to the employer. The best way to look at it or to understand it is through this graph right here. Okay, so this is number of employees working for the company. So if you have to actually get the maximum tax credit, you have to have under 10 employees. Okay. As you go up in employees, the tax credit gets lower and lower and lower until 25, then there's zero tax credit. So it's a function of number of employees up top and then average income for employees. So to get the magic, the 50% tax credit, you have to have under 10 employees and their average incomes need to be less than $25,000, okay? As either you go up in employee count or up in average wages, then the tax credit goes down and down. What we found is we've got lots of groups that are just falling outside of these tax credit. Either they have too many employees or they've got 13 employees that average wages of $50,000, something like that. So this is something we want to take a look at. As I mentioned, if you've already done the tax credit the last 2 years, you're not eligible the third year, so that could disqualify you as well, even if these things fit. And then the other thing is if these numbers do look appealing, we would have to buy the MOTA plan now through the shop, through the shop Small Business Health Plan Finder to be eligible. We can use it with Regents or Premera. So that'd be another, or United or any other ones, that'd be another thing we'd have to look at. Well, do you like the plan, the MOTA plan, and is that plan within the price range to where when you take that plan plus the subsidy, it becomes better than the other options available. So that's something that we're in a position to help you out with, and definitely give our office a call, or we can talk about at your renewal. So what we're going to do now is talk about some of the medical insurance trends that are coming down the road, or kind of, the trends sort of evolve over time. And it's kind of exciting. There's a lot of things changing with healthcare reform. What we're finding in each marketplace is quite different. So the individual plans, all those plans were canceled last year, end of 2013. And most everyone got very large premiums increases, but then the low-income folks got some tax credits to make the plan less expensive, or some people even got tax subsidies that made the plan almost free. And then Medicaid was doubled. So the number of people that got free insurance via Medicaid is essentially doubled in Washington State. And Washington State, it's a Medicaid's a federal-state partnership, so Washington State's on the hook for quite a bit of that expansion in Medicaid, so that's going to really hit the budget. So the people in Olympia are going to have even a tougher time dealing with the budget than years past, because the cost for Medicaid, which has always been increasing, is going to start jumping up quite quickly due to the big enrollment in Medicaid expansion. Small group, so under 50 employees. Most of the plans that were available have been canceled, and that happened mostly throughout the year in 2014. A lot of groups changed their renewal to December 1, 2014 to put off the cancellation for 11 months and kind of lock in a 2013 plan for as long as they could. So what we just kind of finished up with in December was most of those plans expiring and people moving on to qualified, Obamacare approved type plans. And so what we saw were some pretty big rate increases, or a massive amount of employers changing from one plan to another. And that really has caused two things. The big shift, a lot of people changing the renewal to December and January, plus the huge amount of people being canceled and switching plans, has really caused problems with the insurance companies. We've seen a real problem with them being able to process new enrollees, so companies, and getting out ID cards. So we've had quite a few companies, clients that have switched in December or in January, or just renewed their plan in December or January, having trouble getting updated with ID cards and eligibility. And we're just hoping that they work through that as quick as possible. Another trend in 2000, is the shop that we just talked about. And then in 2015, for groups of 50 or more employees, they haven't been impacted quite as much, because most of the plans for 50 or more employers employees were not canceled. They've just been tweaked or adjusted to meet the new mandates. So, the taxes have been piled on, the new mandates have gone in. So it's been, kind of upping the premiums, but not massive changes in the way that they underwrite or the way that they rate groups or plan cancellation. So we've been seeing increasing premiums are not massively different than the pre-PACA. Starting in 2016, they are going to change to where groups of 100 or less employees are all rated the same. So any employees, any groups with between 50 and 99 employees come 2016 could see a pretty big difference in the way their plans are rated. So kind of what we saw this year for the small group may happen in 2016 for groups of 50 to 99, and we'll just keep our eyes on that because that's something that I don't think was very favorable for the small groups, and we've voiced our concern about that to the insurance commissioner and the lawmakers, and they do have an option to postpone that for groups of 50 to 99, and our association is pushing them to do that. So with all of this news and everything about healthcare reform, we are seeing an increased focus on medical insurance, both on employers and employees. There was a big concern that when all this rolled out that a lot of employers would just drop their plans and people to the exchanges. What we're finding is that's not really the case. Most employers are continuing to offer benefits with the major exception of these mini-med plans, and those have kind of hit a lot of news. Like you'll hear about some of the big mega chains like Home Depot or some of the others dropping their medical plans for part-timers. A lot of times those medical plans aren't really what you think of as like the full-blown medical plans that most of everyone has today. A lot of them were kind of limited benefit plans. Maybe they cover up to $10,000 a year for a surgery or 4 office visits and nothing else. So a lot of these people had these sort of minimal, that we call them mini-med plans, and they'd offer those to part-timers or minimum wage, but then a lot of times like the corporate staff would all get like kind of a regular full-blown medical plan with a $1,000 deductible, unlimited lifetime max, that kind of thing. So what we found, a lot of times you'll hear about a big company dropping their benefits. It's really them dropping those mini-med plans, which are now deemed kind of illegal for due to healthcare reform. Essentially, they don't meet the mandates or rules to be a healthcare plan. So that's mainly been the cancellations we've been seeing. We've seen some employers purchasing for the first time to avoid the taxes that are going to come along with these mandates, but not a huge uptake. We've kind of found that employers that were offering benefits before needed to do so for a variety of reasons. They weren't doing it for any, to avoid any tax or anything. It was more to encourage employees to be there and to stay competitive, keep their employees happy. And we're seeing that staying the same. The employees still want benefits through their employer. They want that taken care of. They value that as part of the employment. So really that's not changing.